Cabirou.
Here we go. Well, welcome everyone. Thank you for joining us. Just as a reminder, this is track A. We'll have 3 presenters, one of which will be a pre-recorded video going second. And then after our 3rd presenter, we'll have some time for a Q&A. And so if you have any questions, you may pop them in the chat box and send them directly to me, or you may also send them directly to the presenters. So our first presenter today are Iman, Jandali, and Yasmin Irfani. Iman Jandali has her master's in public health from the Johns Hopkins Bloomberg School of Public Health with an emphasis in health behavior and society. Upon graduating from Hopkins, Ms. Jandali worked as a program support specialist for a global health nonprofit organization dedicated to increasing access to essential medicines and serves for women and girls in developing countries. Ms. Jandali joined AMHP in September 2015 with the hopes of bridging her passion for public health and serving the Muslim community. Her co-presenter is Yasmin Irfani, who received her Master's of Science in College Counseling and Student Services from California State University, Northridge. Ms. Irfani is the Youth Program Director at NAMI and a mental health first aid instructor for AMHP. Welcome, Ms. Irfani and Ms. Jandali.
Thank you so much. And me and Yasmin are really excited to present. I know we don't have a large group, so definitely feel free to raise your hand or interrupt us at any time. We want this to be, as interactive as possible. I did prepare slides, so I'm going to go ahead and share my screen. I'm already sharing.
No, not yet.
Okay, so I'm going to share with all participants. Okay, can everyone see my slides?
I can't. I don't know if others can.
Nope, not right now.
No? Okay.
Are you seeing the option to share slides?
I'm seeing the option to share screen. So there we go. Okay, how's that?
No.
Perfect.
No?
Oh, you can see it?
Yep. You guys cannot see it?
I can.
Looks good.
But,
I can see it.
Okay.
So yes, as my name is Iman Jandali, I'm the program manager at American Muslim Health Professionals, and AMHP was founded in 2012, and the idea was to bring together Muslim health professionals. That actually started off as a listserv, and it has now grown to over 2,000 members across the country. And we host a series of networking events. We have 3 broad areas of focus: professional development, mental health, and advocacy. So today I'm going to talk more about mental health and specifically our mental health first aid training program. This program started, I think we had our first training very early on. It was in partnership with Khalil Center, which is actually a direct services counseling organization. And from that, we only saw more and more increased demand for mental health awareness, mental health services. And so we launched this mental health public education program. And the curriculum is not produced by AMP, and Yasmin will share more about that. It's produced by the National Council for Behavioral Health. And alhamdulillah, we've now certified over 1,000 community members in mental health first aid. And we have a specific target of training all imams and all Islamic school teachers, because they often find themselves in the really critical role of being first responders when people are having crises. And they, more often than not, are not prepared to handle those crises when they occur. So that's a little bit about AMP. Our mission is, we're a nonprofit organization bringing together and strengthening the impact of Muslim health professionals to improve the health and wellness of all Americans. So we really try to emphasize that we're trying to improve the health of all Americans, obviously through the Muslim community, but as Muslims in this country, we definitely want to make sure that we are targeting everyone's public health. And by, improving the health of Muslim Americans, we are, inshallah, also improving the health of the American public as well, especially as we're, seeing with COVID-19, this is something that's impacting all of us as a nation. So as I mentioned, mental health is a huge area of focus for us. And that's largely in part because we've seen just an increased demand for it. We did a needs assessment a few years ago, and mental health was just increasingly something that people came forward with and expressing that as kind of a public health concern that they want to see our organization address. So who here has, I guess this is a public room, but who's heard of mental health first aid? I assume that most of you have heard of mental health first aid. AMHP is definitely not the only organization that's raising awareness about this program. And they are, trying to make it just as common as CPR. What CPR is basically to physical health. They're trying to make MHFA discussed as CPR. So it's an educational program. It introduces participants to risk factors and warning signs of mental health. And it is a full day program. Since COVID-19, they've moved to a virtual platform. So this past year, we took a hiatus from delivering this program in March, April, and May, mostly because we didn't know whether they would move to a virtual format. But alhamdulillah, they have, and now it's something that can be taken from anywhere, from the comfort of your home, obviously. So we're happy to be able to expand that program because they now have a virtual curriculum. So as I mentioned, since we started, we've recruited 9 instructors, and alhamdulillah, all of our instructors are Muslim. They're all very aware of the potential stigma and cultural barriers that preclude our community members from seeking care. So they, a lot of our attendees come forth and say, they really like our instructors. They like that they're familiar with, Islamic teachings, and also just the potential cultural barriers. And Yasmin, my co-presenter, she's one of our instructors. She's fabulous. We continue to get really positive feedback about her and everyone else. So all of the instructors are, contracted with AMHP. I have here that there are 700 individuals. I just did actually today, I was looking at the number, and it's actually over 1,000 now. So alhamdulillah, we do trainings almost on a bi-weekly basis. And we are, as much as possible trying to meet the demand. We've received alhamdulillah over 3 grants to support this work. And especially with COVID-19, people are increasingly seeing the importance of mental health education and awareness. So some of our targeted audience, and people always ask who can take this training. It's really meant for anyone and everyone. Any of us, can find ourselves in a mental health crisis at any point in our lives, or find ourselves as the first point of contact for someone who is experiencing a mental health crisis. So it's definitely not something that, for one set of people or one audience type. We've certified teachers, parents, family members, religious leaders, medical providers, activists. And what's nice about the training is that it doesn't assume any prior knowledge. So you come as you are, you don't need any kind of, prerequisite or psychology degree or anything like that. And you walk away from the training really with kind of a step-by-step approach of how to address a mental health crisis. And so here are just 2 testimonials, one from a Chicago resident. So MHFA training is a great tool to learn actionable steps that could potentially save someone's life. I'm grateful to have learned more about mental health and now feel better equipped if I were to find myself in a crisis situation. So it's really, people do walk away feeling very empowered to be able to not only address their own mental health, symptoms if they're experiencing them, but really the mental health crisis of others. And so, as I mentioned, we recruited 6 Muslim mental health instructors, and we have both youth, we do both youth and adult trainings. People have asked what's the difference? You have to be 18 and over to attend a training because some of the material is just meant for an older audience. The youth training is primarily meant for individuals who work directly with youths age 12 to 18. So this would be the target for Islamic school teachers. And there's just more information about potential mental health crises that youth are experiencing. And then the adult training is for anyone, for really anyone. And we do both, and our instructors, like Yasmin, they're either certified in one or the other, or they can be certified in both. So I will let Yasmin take over and talk more about the specific curriculum.
Cool, thanks, Iman. So, okay, so why should you invest time in mental health first aid? There's 3 key reasons. It's an educational program. As Iman said, it's so empowering. People come in and afterwards they share that the 6-hour Zoom just flew by. It was so interactive and hands-on. And they say that it's really an enlightening experience. And the thing is that oftentimes in our Muslim community, we focus on once a crisis has happened. But the great thing about this course is that it focuses a lot on early intervention so that somebody doesn't have to wait until they are at their breaking point to take mental health seriously. It's just like CPR, like mental health is just as important. When we know the statistics and we know this affects our Muslim community, I think it should be mandatory for every single Muslim adult over 18 to become certified, because we all can save lives and change lives. And it is evidence-based. This course is taught all around the world in over 25 countries. And you receive a certificate, which is really exciting for those who like to put that on their LinkedIn and just spread the word about that. And let's see. Yeah, there's just so many benefits showing that this works. This 5-step action plan, it works. And as an instructor, I have seen the power this training has on changing lives, validating the feelings and experiences of Muslims of all ages, providing hope and healing. Like when someone breaks a leg, we don't not talk about, when someone like breaks a leg or is diagnosed with cancer, treatment and recovery is part of the conversation, but with mental health, it's often missing. So this course is here to change that. And really it creates a sense of community. And from my own personal experiences with depression and anxiety, I see how when I was growing up as a young Pakistani Muslim girl, if the adults in my life had taken this course, my journey would have been so different. So I'm just so grateful that this program now exists. And I think that everyone should be certified, inshallah, and happy to answer any questions or comments from any of you for the remainder of our time, because nobody should have to be alone in this struggle.
Yeah, thank you so much, Yasmin. I did want to share, and I can share this in the chat box. People always ask, how do we request a training? How do we attend a training? Obviously, we take a break in Ramadan. It's just too hard to do 6 hours virtually. So we do take a break in Ramadan, but I'm going to share what I can do in the chat box is I'll share our website, mhp.us. And I'll also share the direct link for if you'd like to request a training. We do trainings for community organizations. So there's a form that you can fill out if you're an individual and want to attend a training. That's completely fine. You'll be put on a waiting list and, you know, inshallah, attend our next, you know, open training. Or we train, as I mentioned, Islamic schools, Masjids, and community organizations. So a community host can also request a training for their community members. And just some of the nuts and bolts of it, our trainings can host up to 30 individuals. So, you know, if you and your spouse, you and family members, you and, or as I mentioned, a masjid or Islamic school, we typically try to, you know, fill our courses to the maximum, and it is 30 attendees, and in part to kind of create that more intimate environment so that if you have questions or specific concerns, you can direct them to the instructors or within, group settings.
I don't see any questions coming in here, but maybe I can offer one. I'm familiar with the training. I wonder, how do you account for cultural practices or cultural beliefs within the scope of the training? And I guess in this case, religious practices and religious beliefs.
Yeah, well, from my experience, the new updated curriculum actually has cultural considerations in mind. So we always make sure that there's enough time for discussion and seeing like what can we do despite the differences. And what we find is that among most cultures, like there's so much commonality. So it's really beautiful how this action plan can be tailored towards anyone from any background, race, ethnicity, gender. So yeah, I think just by addressing it and being open and talking about it, it helps with that.
I think also like it also just helps to talk about it, because I think it also validates that, if people are not experiencing these things alone. A lot of times people, they'll go through things, or especially parents, in isolation, and they think it's just their family or their community. And I think part of this training is to really normalize mental health as much as possible, normalize anxiety, normalize depression, normalize these things that people might feel shame around. And I think just by becoming just more aware and educated, we also are creating kind of a language around talking normally and frankly about these things, because these are things that we're all experiencing. And as I mentioned with COVID-19, it's unfortunate, but with social isolation, people are increasingly experiencing these symptoms and becoming a little bit more comfortable talking about it.
Okay. Thank you for responding to that. It looks like we have a lot of questions coming in, and I was just reminded that we're going to save the questions to the end after all presenters have given their talks, and so that we can come back to some of these questions that have filled up in the chat box.
So thank you. I'm going to go ahead and present the next video. If you want to go ahead and introduce the speaker.
Yeah, so the speaker in this next video is Leila Warraich, who is a third-year doctoral candidate at William and Mary University in counselor education and supervision. She's a co-director of the New Horizons Family Counseling Center, where she also works with families in the Hampton Roads area. Her research interests include stigma in counseling, refugee and immigrant mental health, Muslim mental health, and multicultural competence in counseling and supervision. And as I mentioned earlier, Akila has a pre-recorded video of Leila's talk.
Okay, I'm going to go ahead and play it. Let me know if you guys can't hear it, because that did happen earlier today.
Everyone, I'm glad to be able to be here today. Assalamu alaikum, everyone. I'm glad to be able to be here today, even if I'm not physically there right now, to be able to present on my research. My name is Leila Warraich. A little bit about me. I'm a third-year doctoral candidate. And actually, this is, alhamdulillah, my dissertation research that I successfully defended last week on. And so, mashallah, a great milestone. And I'm just really looking forward to being able to share that with you all. I'm in the counselor education and supervision program. So I'm a trained clinician in background, and I'm interested in academia and in research. So the title of what I want to share with you all today, the study that I conducted, is Spiritual First Responders, the Experiences of Imams in their Mosques during their personalized interactions with the congregants that they serve. And so I'm going to try as succinctly as possible to get through a lot of the great information that I found and how this might be relevant to our work as Muslims, Muslim clinicians and Muslim researchers as well. So just very quickly and very briefly, we obviously have developing literature around this topic. we understand that Islam is a growing faith in the United States, and Muslims are growing with their unique particular clinical needs, as well as just their overall clinical needs. We have a bit of an understanding of how healing and mental health looks like in Islam. What does the Quran guide us about counseling and about healing, and what are the different types of modalities that we engage in, whether they're indigenous to us and their traditional healing practices, or whether they're kind of Western modalities. I come from a counseling background, so also we have our multicultural and spiritual competencies in counseling about how to integrate that work to be able to honor the diverse needs of all of our clients that we serve. And we have some budding literature around imams and what mosques and masjids look like as well. And really where we're finding a gap was emerging is that we don't really actually have a good understanding of what really happens when imams choose to meet with their congregants in that individualized interaction. And so I didn't choose to call it counseling because I didn't want to limit what that may be like. Any really individualized form of support, what that may look like. And so my study was really to be able to look into that further. I decided to use a social constructivist framework, of course, because the question was really broad and we were yet to learn more about this topic. Qualitative methodology really seemed to make sense. We're looking at the phenomenon of what exactly the experiences of imams are in that situation where they meet with their congregants. And so a phenomenological approach made a lot of sense. And just based on my own experiences and based on who I was as the researcher in qualitative work, the researcher is the instrument, I decided to employ a hermeneutic phenomenological approach in my work. So the research question that came up from that was, what are the experiences of imams in their mosques during their personalized interactions with the congregants that they serve? And what I was able to do was use purposive criterion sampling. There were eligibility requirements for who could be part of the study. So imams had to be 18 years old. They had to be at least 3 years of experience, currently serving in a masjid right now. And based on recommendations from others in my committee, we decided for now to limit the sample to just Middle Eastern Arab and Asian imams, because we didn't want to dilute away the experiences of, let's say, Black, African American, or Latinx imams in this sample. So inshallah, my next future research will be looking at their unique experiences. And also we engaged in snowball sampling, since it can sometimes be hard to find individuals who will interview with you. The way that I triangulated the data was I had a demographic questionnaire. I conducted a semi-structured interview. Interviews ranged from 1 hour and 15 minutes to 2 hours. And then we also asked imams to bring in artifacts. So we asked them to bring a guiding scripture, a Quran ayah or hadith that guided their work as an imam, and use that also for data analysis to add to the findings as well. Here's really briefly about the participants that I had, their demographic information. So just some important things to note are there's a wide range of ages, a wide range of experiences in the US, and a really wide variety of formalized training. So from no formal training all the way to the Ph.D. They're serving different sizes of masjids as well. Majority of the imams were in the state of Texas, and the majority of them were Arab. So these are just some important things to notice as well. So what kind of emerged, I interviewed these imams, I asked them to bring the artifact. I used mostly Mustakis' method of data analysis to be able to condense down, use a horizontalization chart, and was able to emerge out with these, we would call 5 overarching themes about their experience. So imams' experiences include intentional communication and engagement with their congregants. Imams' experiences include incorporating DEEN, of course, into their work. Imams' experiences include contextualizing congregants as a fiber of their community. That's a sub-theme. So really contextualizing congregants in relation to their community, and then also contextualizing congregants with a focus on individual freedom. So who they are individually and what they may need. So this community piece and this individual piece, contextualizing them in both of those realms. Imams' experiences also include conceptualizing their own identity, their professional identity, their personal identities, and how that influenced their work. And then of course, imams' experiences include collaboration with professional helpers as well too. So for the sake of time, I have a lot of information that I could share, but I just want to walk through some of the category areas that emerged for each one of these themes. The first theme was about intentional communication engagement. So Imam talked about opening presenting with openness, listening, non-judgmental demeanor, stuff like that. Supportive guiding practice, encouraging people, motivating individuals, really helping them by questioning them, answering what they may need. Setting structure and expectations outside of session and inside of session. Here's what I can offer. Here's what I can't offer. Here's the time that I can give to you. And documenting with discretion. So confidentiality and protecting confidentiality was really important, but also Imams talked about how they kind of documented or went about documenting their work as well. In the second theme, Imams' experiences and their interactions include incorporating DEEN. This makes a lot of sense. They are Imams. But a big chunk of that emerged was using scripture as hidayah, as guidance. And this actually ended up aligning really well with the artifacts that I had collected. So when I analyzed the artifact, there were 3 sets of areas that Imams felt like drove their work. Whether one was, they felt like there was a service, their service in helping meeting people was a duty to Allah or to their congregants. Some Imams talked about how it was important to honor all congregants. Doesn't matter what their diverse backgrounds may be. And then of course, some Imams talked about how their work is really about shifting focus from Deen over to Dunya. So really focusing on Deen over Dunya. So really helping people think about long-term as well. And then of course, they talked about traditional Islamic healing practices, things that we know about as well. So dua, dhikr, and in some instances, hasad, trying to ward off hasad or doing ruqya as well too, if in case there was influence of magic on the individual. The third theme, as I mentioned earlier, was about contextualizing congregants. So Imams' experiences include trying to make sense of their congregants as a fiber of their community and also with their individual freedom. So when you're thinking about what does that include as a fiber of their community, Imams shared that the masjid environment played a really big role in contextualizing their congregants. Of course, the study was conducted during the pandemic. And so Imams all talked about how the pandemic was something that they had to make sense of and how that was influencing people in the community, really influence their work. Imams also talked about, the community's needs. What does that particular community need based on the socio-political, cultural considerations around and the location as well too. And then also they talked about the role of spiritual healing and mental ailment. So what's the community's perspective on spirituality, on healing, on the intersection of those? All of those need to be used to contextualize the congregant as a fiber of their community. On the other side, they also need to contextualize congregants as the individuals that they are in their freedom, So this included what particularly did the congregant need, the specific person they were working with. Also, what were the reasons for seeking that imam? A lot of imams disclosed mostly it was around a relational work. If it was, alcoholism or other types of more intense types of considerations, they would refer. But if it was about marital issues, it was about, issues with parenting, issues with people in a family. That was things that imams felt like was their realm and area. They also talked about the stigma for seeking help, the individualized stigma that people might face. And then they also discussed some particular challenges, whether it's around culture and faith, trying to help congregants navigate that, or congregants coming very last minute and asking imams, please, can you fix this? And it just being a little too late in their opinion to be able to fix it fully, fix it with quotation marks. So the fourth theme was about conceptualizing their own identity. Imams talked about how important it was that the way that they viewed themselves professionally really played into how they then sat with and were with individual congregants in that individualized support. So expectations that were on them as leaders in the masjid. They talked about their formal training. There was a diversity of formal training in my participants. And so really some saying that they wish they had more, some saying they wish they had more, they didn't have any, whatever the case may be. So sharing how formal training was important. And then informal training, a lot of imams talked about experience being their best informal training, but also seminars or workshops or whatever else they attended to help to. I had an imam who said that he attended
I just got a request. Oh, not here? Okay. Let me know when you'd like it paused.
Customer service training and related to anything, but to help him sharpen his communication skills with his congregants. Additionally, the imams talked about their civic and civil duties outside of the masjid. So interfaith work and being able to build those relationships with the community that was part of their job. And then the influence of their personal experiences onto their professional work as well. So work-life balance and stuff like that as well. And then lastly, imams talked about how Their experiences include encouraging collaboration with professional help. This is really interesting because general literature says that clergy members often take the burden of care onto themselves and have a hard time referring. And that's not to say that these imams may have not taken burden of care, but across the board, all imams that I spoke to said that at some point it's beyond my scope and I need to refer this out to somebody else. So that was a common experience that participants shared. And then other participants talked about building alliances and collaboration. Like, it's really important that we collaborate with professional helpers and a variety of professional helpers, whether that's like law enforcement. One imam talked about law enforcement, but also whether that's about other professional counselors, whether about doctors or nurses, whoever the case may be. It's important that we build collaborations. And imams also talked about it's important to build collaborations with each other in order to consult with each other on situations to give the best guidance, especially around divorce. This was something that was common. So very briefly, all these, I just want to go back, all these themes that emerged, that came out from right over here, were really imams' experiences that they shared in terms of this individualized support. So we really didn't have a glimpse or understanding of what exactly is happening for imams in that individualized interaction when they're meeting. And inshallah, I hope in the future to continue to research this. But what really came out from this, from a clinician perspective, is we have to collaborate. We have to work together. Imams are doing a wonderful job on their own, but they feel a little disconnected. And we are doing a really good job. And sometimes we feel like we're missing that spiritual piece. And we are competent in some manners to provide that, but also sometimes we are not. And so knowing what our role is and communicating that to imams and imams communicating their role is going to be really, really, really important for us. So a little very briefly about some implications. And I hope that with the other presentations that are presented today, good discussion around this is also emerges. I have no doubt about this as well, but I actually wanted to break my implications down for clinical practice, for training and research, since I am a counselor educator, and then actually very humbly, with total recognition that I'm just a clinician, I'm not an imam. Based on what I heard from my participants, I just wanted to share some implications for maybe imams as well too. So particularly for clinical practice, it's really important to collaborate with the imam, to build that kind of relationship with them, especially for us Muslim clinicians. This might not be hard to do at all, but I would even recommend this, of course, to non-Muslim clinicians. Learning more about Islam. I know for a lot of us who may be Muslim, we think we know, but it's really important to immerse ourselves in that as well. But I would also say, particularly for non-Muslims to learn more about Islam, to reflect non-Muslim clinicians, to learn more and to reflect more about and challenge their own views about Muslims as well too. It's incredibly important that we assess religion and spirituality in session, and try to understand where the client is and what that means to them, because it looks different for each person. And then I would say, with the client's permission, incorporating traditional practices. So not shying away from that it's not our lane to make dua together or to do dhikr together. Those are things that we can do, or to read scripture together. But that if the client gives that permission and you're collaborating with the imam, getting a better sense, then definitely that's something that you should do that is going to be helpful to the client. Just some very briefly about training and research. It's really important that in our training of clinicians who are emerging, especially I'm a counselor educator, attendance to spiritual competence and helping understand the value of spiritual competence, embedding models of cultural humility into our work, not just as a disposition, but as a skill. When we judge clinicians' tapes in their earlier days, let's judge your skill of cultural humility as well too. I would say for research, we need an expansion to community-based models. So community-based participatory action research type models are really incredibly important to help meet the needs of the community and research from the community itself. And then engaging our students and our clinicians as they're in training around experiential and service learning activities that really immerse them into the masjid, immerse them into the Muslim community, so they can understand more than just, learning from a book. And then really, really briefly for imams, as I mentioned, I offer these suggestions really humbly, but imams to continue to build alliances with their counselors. So a lot of my imams talked about having a list of referrals that they send out to, but to collaborate with them and learn from those counselors. There's a lot that the counselors may be able to offer to fill gaps. Imams have great informal training with each other. Imams have teachers and mentors that they discuss with, but maybe some of that formalized training. We know that in our clinical practice, we have formalized supervision. I wonder if there are elements of that we can integrate for imams. Increased training in mental health and interpersonal skills. This is a great place where us as clinicians can help imams with that too. So some of those basic skills, a lot of my imams talked about how experience taught them a lot of what they know. I wonder if we can bridge that gap earlier on. And then of course, creating mindful and inclusive spaces in the masjid, which can help continue congregants to feel safe. So that's just very, very briefly about my study. I'm very thankful to be able to still present briefly upon it. I hope today's discussion is really fruitful. And I'm very sad that I can't hear from my panelists, but I look forward to going back and hearing their research as well. This whole topic area is incredibly interesting to me, and I'm hoping to continue to collaborate and work in this area with you all as well. If you have any questions, my email is here on the slide. And inshallah, I hope to looking forward to hearing from you all. Inshallah, I'm very thankful to be able to present this as well too. Jazakallah khair.
Great. Thank you, Akila, for playing Leila's video. We're going to move on to our last presenter for this segment. And our last presenter.
Yes, this is Iman speaking. Unfortunately, we have not. This has definitely been a goal of ours for several years now. Right now, we focus so much on, the coordinating these trainings. We do have data on all our participants. We have data on which states we've conducted, obviously data on the communities, the masajid, and even, the individual attendee lists. And then we also, the National Council on Behavioral Health has evaluation forms. So we have tons of evaluation data of the specific curriculum. There's also a lot of research that's been done on the curriculum in general, not specifically for the Muslim community. And as I mentioned, that's certainly a goal of ours. We obviously need the staff and grant support to support that kind of research, but it is a goal. At the moment, our research right now is basically just descriptive, where the demand is, who's taking the training, what's the professional background of the people demanding the training, which states are we serving, the gender breakdown of participants, race, ethnicity of participants. So right now it's more descriptive. We don't have any, we're not making any correlations or causal type of things at the moment, but that's certainly a goal of ours, and hope to do it in the future.
Thank you very much, Iman. The next question for you and Yasmin is, what has the response been like from the imams with MHFA? I'm from Cape Town, South Africa, and as a mental health practitioner, I find it problematic that there's still so much stigma with the Muslim community around mental health, and especially with our leaders and how they respond. I'm wondering if this is something that could help with that.
Really, really good question. Let's turn on my video again.
We can't hear you, Iman. You're on mute.
Okay, is that better? Really good question. As I mentioned, this is a good question. People often ask of us, how do you reach these really difficult to reach communities? We don't, one thing we really try to do at AMHP is wait for communities to come to us, which means we might be missing some of those, communities and imams that are still stigmatizing mental health, unfortunately. But we are not, so much of this educational program is people ready to receive and actually incorporate it and actually, be open to it. And alhamdulillah, I think more often than not, imams and communities are open to it. We have faced a little bit of stigma and resistance in some situations, but for the most part, this curriculum is really meant to help people. It's not meant to, proselytize or to undermine the DEEN or to say that, there's no role of religion in mental health, in addressing mental health issues. That's not at all what the curriculum is saying. So we try as much as possible to work with communities instead of, replace them or replace the imam. imams are not, they're not necessarily equipped with addressing a lot of these really difficult mental health challenges. And that is something, we, alhamdulillah, we have, mental health practitioners, and we do have, referral systems and services that people can access. And our imams are already, overworked and spread thin. So we also are trying to help imams and help them to, direct individuals and community members, their congregants, to the resources that they need. But definitely stigma is something we continuously experience. But as I mentioned, we really wait for communities to come to us. We don't go into communities and say, you need this. I think that's when people really kind of become more resistant to mental health, awareness and education. In general, and one of the unfortunate things is a lot of times people come to us, I don't want to say too late, but it's always in reaction. So for example, there was a recent suicide in Chicago. And so it was after that suicide that then they saw, then they reached out to AMP to do a, QPR suicide training and a mental health first aid training. But we don't want to wait until, tragedy strikes before we act. But at the same time, we don't want to force communities that are not ready to receive this information. We don't want to push it down their throats. We wait for them to complete our event request form, and then we take it from there.
And Iman, you made a very good point. Sorry, I hear an echo. Made a very good point around people, only the imams that prompt AMHP to give this presentation are probably the ones who are more open to it or ready to receive it, whether as a result of a crisis or they're just genuinely interested. So potentially they're more likely to have favorable views around MHFA versus others who may not be ready to receive that information.
Yes, that's absolutely correct. And a lot of times our experience is one person in the community will take the MHFA training and then they will share it with a family member or someone at the masjid or someone on the board of their organization. And that's really been the best type of referral system, is when, someone who is well trusted is encouraging the community to participate in this training.
Misbah asked how he or she can become an instructor for mental health first aid.
That's a great question too. There's training taking place all around the country, and to become a certified instructor, I believe you have to attend a 4 or 6 day full day training. Yasmin, I'm seeing you're on here, so if you want to answer more, because I'm not an instructor, I'm a coordinator, but I'll let you answer that.
Sure. So it is 3 full days of virtual training, and there's some pre-work that you need to do. It's a little bit pricey if you become an instructor through the National Council. It's around $2,000. But if you can find an organization to teach for, they may be able to cover your fees. So I would recommend just being persistent and asking around, because you never know. Like when I wanted to become an instructor, I couldn't afford it, but then when I started another job, they had an opportunity to become trained for free. So just staying connected in the community, and inshallah, it could happen. And it's amazing. It's so worth it. And once you become an instructor, as long as you teach 3 classes per year, you can remain an instructor for the rest of your life.
Thank you so much for that, Yasmin. And then for our next question was in regards to Leila's presentation and wanting to see the demographic information for the imam. Here we have it here. So we can take a moment to look at it. I don't know if the person who asked that question has a follow-up question with regard to this. Of course, Leila is not here to answer it, but we can share her email address so that you can direct it towards her. Akila, do you know if we'll be able to share the PDF of these presentations with attendees afterwards?
Yeah, these they'll also be uploaded on YouTube, and I will double check and see if they're going to be loaded onto our Huva app.
Awesome.
But
so
I will drop the her email below if anyone wants to reach out to her.
Perfect, thank you. The last question that we have with regards to the MHFA training is whether it can be accessed from Canada And can a nonprofit organization employees along with volunteers participate as well?
Another good question that we've received a lot of. So at the moment, we are kind of focused on, the states, and we haven't, broadened it to outside the states just yet. That doesn't mean we won't consider it in the near future. So I definitely would still encourage you to fill out our event request form. And I think I shared it in the chat. I can share it again here. So I would definitely still encourage you to fill out the request form, and especially if you're an organization, you'll have a much higher chance of getting approved than an individual. We try as much as possible not to have a fee with these trainings. We try as much as possible to have them free and accessible to the public, especially for Islamic school teachers and imams. But if a community is willing to subsidize part of the cost, then we're definitely more willing to consider doing a training there.
Thank you. Those are all the questions that we have so far, but I do have a follow-up question for Betül based on the findings of your research. I'm wondering whether for some of the young adults and younger participants, were they able to touch on what deters them from engaging in the masjid? I know that you mentioned that some of the adults spoke about wanting to include some of the young adults, wanting to re-engage the young adults in the masjid. Were the young adults able to touch on what deters them from participating or engaging?
So in terms of the range of participants, unfortunately, I don't have participants in the adolescent age range, which would have been very valuable. In terms of the young adults, so when the participants were speaking about needing to re-engage the youth, they were generally referring to like high school youth and I guess though like university level to some extent as well. For the young adults, from the participants I spoke with, it was about that like lack of programs for them. So they felt they didn't fit in. So I think it's about finding ways to, so what do they need to be able to feel like they fit in, and what services can we provide for them? One of the mosques did have programs for university level students, specifically like helping first year university students navigate entering university, for example, and that was successful. So I think it's similar to brainstorming new ways to engage children and youth. We really have to think about innovative ways to have the young adults feel welcomed into the mosque.
Thank you for answering that. I also noticed that for some of the programs, there were a lot of really cool and interesting and innovative programs that those some masjids were organizing. Did they speak to how they developed those programs? Were they in response to mosque members inquiring about those programs, or how did they come about developing those programs?
That's a good question. So for some of them, I don't know. So the ones for the seniors, for example, like the deaf and hard of hearing, I'm really interested to know more about that. Unfortunately, I didn't speak with someone who had that knowledge. I do know that that mosque specifically has a really active role in trying to engage elders and people with disabilities into the mosque. So for example, for their Friday sermons, they do have an ASL interpreter for their Friday sermons. Even during COVID, you have the ASL interpreter in the corner of the screen. So for that mosque specifically, it seems to be part of their culture and part of the work that they're trying to do within the mosque. And for the community repair workshop, for example, that was initiated by the congregant who felt like, I have this knowledge in engineering, I want to engage with the youth, and he developed it himself. For the program for gang and violence prevention program, that was really actually put forward by the imam himself, and he is really passionate about that, and he really wanted to, so he's working really hard even during COVID to have a group of people and trying to get young people to be on board with him to support other young people. So those are the only ones that I know of, but it is a good question and worthy to explore how those initiatives come about.
Mm-hmm. Just by hearing, what you're saying, it sounds like there's an attunement to the needs of the community, and it's also driven by the individual's own genuine passion for engaging with their mosque members. Do other folks have questions for any of our presenters or comments that they would like to add? We have about 10 minutes still. Otherwise, we can go ahead and wrap up. We thank you all for joining us for this segment, and we look forward to seeing you at other segments over the rest of the weekend.
Thank you so much, everyone. Assalamualaikum. We'll
Thank
see
you.
in the closing remarks shortly.
Islam.
Waalaikum.